Primary healthcare in Africa and in the world is really the backbone of every society. But when you look at the demographics, the bulk of the working people in primary healthcare, whether they are doctors, public health officers, community health workers, nurses, midwives, the bulk of them are women. They constitute more than 75% of those are women. But when it comes to the decision making around where governments and institutions invest in primary healthcare and to make it effective and working, we find that women are totally underrepresented.
Women are the ones taking care of the children, the community, the nation, but they are not there to decide on the health issues in the community.
I think in the work that I also do in supply chain, commodities, markets, it's very male-driven. Everybody that has a decision-making power in my country, in Tanzania, is a male.
You know, there are so many hurdles along the way. There are so many cultural barriers along the way that really pull women down from being able to live out to their best selves.
Women Lift Health as an organization exists to support the development and empowerment of women who are leading healthcare across regions. So we're here to help build the leadership muscle for women who are leading the different areas of their space and to enable them to step from influence into power so that healthcare system can shift radically, that women can be part of designing healthcare system, not just the ones executing and implementing what someone else has done. If we're talking about leadership in different countries, and this is to impact healthcare in those countries, the biggest stakeholder is government, because the buck stops with government in any country, especially when it matters healthcare, education, name it. So how do we then bring governments round the conversation and round the table to walk the journey with us? We owe each other that.
I have been fortunate enough to have women leaders who have come before me invest in my leadership journey. These women have provided me with mentorship. They've also provided me with coaching that has propelled me into the leadership trajectory that I currently am.
The journey, beyond developing my own confidence, it also helped me be more kind to myself and be kind to others as well. So leadership is not necessarily about perfection or impact, but it has helped me understand that leadership is also about listening and learning and also caring for other people and developing other people as well.
So this leadership journey has really built my skills, my competencies, and my courage to look at a health system in terms of the ecosystem and ensure that I am driving equity, that I'm driving responsiveness, that I'm really focusing on the needs of the community. As a leader now, I am able to lead authentically, I am able to lead with my values, and I'm able to lead with purpose.
So what I take with me is that I should be authentic, I should be myself, and I should use my platform to lift others up. Because it's very easy to be in a place where you feel you're privileged, but it is important to lift others up.
As they graduate, we call upon them to send that lift back down, because there are many more of us who've been left behind, struggling, doing the hard work, and not being part of the design process. As we said at the very beginning, women are the bulk of the guys doing the hard work, but when it comes to designing the output, designing the ecosystem through which success can be measured, they're not on the table. So sending back the lift is ensuring that we are just not the few of us who've done the leadership journey and are growing. Are we getting other women to come on the journey that we've been on? Are we opening up more doors for them actually to be able to see themselves for the purpose for which they were created, for the power that sits within? Sending the lift back up is bringing more women into the fold, but more importantly for you to also open up more opportunities even at your day-to-day workplace to make sure that those women are seen and they're heard and they're actually being enabled to be better for themselves.